a member of the Global Fibroids Alliance, and it's a pleasure for me to welcome all of you today. So the Global Fibroids Alliance is a diverse alliance group of health and wellbeing practitioners, researchers, and consultants who've come together to explore how we can strengthen the global approach to improving the information, treatment, care, and support for all those who've been affected by fibroids. And as we know, fibroids is a women's health issue that we feel for too long has been neglected. And we'd like to change this and ensure that women have all the information and support they need to manage this health issue. So our plan for today is that we've brought together panelists from across the world so that we can explore the challenges that women face and possible solutions. So what we're going to do is we're going to have two panels with a break in between. So the first panel is going to feature speakers from Canada, Trinidad and Tobago, Jamaica, and the US. And this will be moderated by our lovely Dr. Sydney Dillard. After that panel, we'll have a Q&A with all of you, with the audience, and then we'll have a short 5-minute break, and then we'll come back for panel 2, which will feature speakers from Ghana, the UK, and France. And this panel will be moderated by Candice Bryan. We'll then have a Q&A following that panel discussion, and then we will close. So during the event, please feel free to chat to each other and to chat to us using the chat box. So if you want to share any thoughts, any comments, any suggestions about the way forward for women with fibroids, please do feel free to do so. So you can put that in the chat. If you have any questions or if any questions arise throughout while people are giving their presentations, please feel free to put your questions into the Q&A box, and then we'll get to them during one of the Q&As. And so without further ado, I'm not going to talk for long. It is my very great pleasure to introduce our first panel and our first moderator. Our moderator for our first panel, Dr. Sydney Dillard. So Dr. Sydney Dillard is an associate professor of communication and graduate director for DePaul University's Public Relations and Advertising Master's Degree Program in Chicago. Her areas of expertise focus on visual communication, health campaign development, and sustainable university community partnerships for social change. She has published multiple manuscripts about the social, psychological, and the economic impact of fibroids on women's lives. So it's my pleasure to welcome Dr. Sydney Dillard. So Dr. Dillard, over to you, and I'm going to stop sharing my screen. So
thank you so much, Candice, and thank you everyone for joining us. Again, my name is Dr. Sydney Dillard, and it is a pleasure to be a part of this movement. Actually, this is a very important topic. It's near and dear to my heart, as majority of the women in my family have uterine fibroids, and I've seen the havoc that it can reach, that it can impact on different aspects of your life. And so I think that this discussion today will be very helpful so that we can start to have open dialogue about fibroids and finding out more about the resources that are available globally. Like, this is really important because of that. So with that being said, what we're going to try to do is give some time for each panelist to discuss some details about their uterine fibroids within their organizations. And then we will again come back for Q&A. What I'll do is introduce each panelist individually before they begin speaking. This is more of a conversation in some ways, so feel free to add questions in the chat box, and as I see them, I'll try to put them all together and come back and present them to the panelists. Unless we have any questions, we can go ahead and get started. So I am very, very excited to introduce our first panelist. To get to her bio, and I'm so sorry if I say this incorrectly, but Joanne Ukposidolo. She graduated from McMaster University with a double major in biology and psychology. Soon after, she completed a 2-year intensive master's program in physical therapy from the University of Toronto. Right, so Joanne is a registered pelvic floor psychotherapist, physiotherapist, co-founder, and co-owner of WombCare Clinic, a reproductive health organization centering around Black, Indigenous, and people of color, so BIPOC women with pelvic health issues such as uterine fibroids and endometriosis. She has a passion for treating symptoms of these conditions in addition to pregnancy and postpartum care. One of her goals in life is to create positive, direct, and generational impact by empowering women to have a healthy relationship with their pelvic and reproductive health. As an empathetic healthcare provider, Joanne observed the significant discrepancies on how healthcare is experienced amongst communities. And intending to make a change, she also co-founded Open Dialogue Canada, a nonprofit organization for healthcare providers committed to improving the quality of care experienced by BIPOC communities. She also values compassion and cultural humility and believes that community is key in the comprehensive understanding and management of an individual's health. So she aims to create change and galvanize others to support dignity and equity for all individuals. All right, and it's without further ado that I hand the mic and camera over to Joanne from WombCare Clinic. Thank you, Joanne, for being here.
Thank you for inviting me so much. So I'm just going to share the screen and get this started. Okay. So let's go from there. Okay, so you guys can see the screen. Yet again, just a little bit of housekeeping. If you guys do have any questions, please feel free to put it in the Q&A. Once again, my name is Joanne Ukposidolo, and I am the co-founder and co-owner of WombCare Clinic. I'm a registered physiotherapist and a pelvic floor physiotherapist. So today we are going to be talking about the challenges that are being faced within Canada, and then also how we have been addressing these challenges as the WombCare Clinic. And then we'll finish up and wrap up with the next steps. So what we can see on a national level as well as internationally. So we want to really focus on what the challenges are with women in fibroids in North America and specifically in Canada. So we can see that uterine fibroids appear in 70% of white women and 80% of Black women. However, 20 to 50% are symptomatic. And we see that in BIPOC women in both Canada and the US, they tend to have more reproductive health challenges compared to their white counterparts, and more incidences, more disease burden compared to their white counterparts. And in fact, so when we take a look at diverse women, they face the following issues at alarming rates. So they face lack of culture sensitive healthcare providers, lack of access to affordable treatment options, lack of community hubs for support. And we can see that uterine fibroids itself is a $35.5 million industry within Canada itself. And once we actually take a look at it, the majority of the fact is they are the leading cause of hysterectomies performed in Canada. So Canada actually has one of the highest rates of hysterectomies performed in the world, with uterine fibroids being the leading cause of them. So what have we done in order to try and address this? So together, along with my amazing business partner, Amoy Jacques, we founded WombCare Clinic. So WombCare Clinic is an absolutely beautiful place in space. It's a comprehensive interdisciplinary care that's focused on centering BIPOC women with reproductive and pelvic health dysfunctions. So the majority of our foundation is based and steeped in a cultural humility framework. So this is where the patient is teaching us about their culture and leading the way in order for them to be the custodian of their healthcare itself. Okay. Due to the accessibility, we've also created community programs. So community programs are 6 to 8 weeks in total. They are at an accessible financial price point, and it creates a brave and safe space for women to be able to discuss specific conditions and also receive a heavy amount of education in what their condition is and how to navigate the system itself. Okay. Specific to our clinic, we have three specific disciplines right now: kinesiology, pelvic health physiotherapy, as I said, and also occupational therapy, which kind of talks about how to function day to day within the condition that you are experiencing. So we know with certain conditions such as uterine fibroids and endometriosis, there was a huge amount of impact on your day-to-day activities, absences from work, how to navigate friendships and relationships. So we really do understand the ability to have a psych component on board in the form of an occupational therapist. So once again, the services that we deliver are kinesiology, occupational therapy, pelvic health, as well as community programs. Okay. So the way that we deliver these modes are either virtually. So this means that anyone who has access to their phone or to a laptop or to a computer can actually access us in a way that is convenient for them. So this means that they're saving time and energy, they're comfortable within their own environment, and they're also saving on gas as well as childcare, which we know can be quite detrimental in stopping people from accessing services itself. In certain situations, we definitely encourage people to come in person as well. And from this, we can also do a hybrid model of care. So making sure that we're covering all the bases and so that patients can actually come and see us in any way that's convenient to them. So once again, we do see abnormal uterine bleeding, we do see uterine fibroids, and then we also see symptoms that are coming up from there. So such as abnormal uterine bleeding, dyspareunia, which is pain with sex, vaginismus, vulvodynia, and vestibulodynia, which are all pain within the vaginal and vulval regions. And we also see patients who are coming in with pelvic pain itself, which can be seen in low back pain or hip pain. Once again, we do realize that the social impact that uterine fibroids can cause, such as anxiety and depression, and we do see patients and work in an interdisciplinary model in order to make sure that that is taken care of. Okay. We also don't want to neglect the fact that there are some women who do not know that they have uterine fibroids until they are pregnant. So we want to make sure that we are there with them, guiding them through that journey, pre and postpartum as well. So the way our patients are seen is we do a consultation, then an initial intake, a treatment plan, secondary provider, an interdisciplinary team, and then a discharge. Through it all, we are really making sure that we are liaising with their entire healthcare team. We understand that this condition is multifaceted and it's complex. And we really want to make sure that we are helping women navigate the Canadian healthcare system as much as possible. So what's our next steps from this point? How do we improve the situation for all women with fibroids on a national as well as an international scale? So right now, we really want to focus on gathering evidence based within a Canadian context. At this moment in time, Canada does not really derive race-based data, and we really can't change what you can't measure. So we really want to make sure that we're getting good information from a Canadian point of view. And from that data, we can then build population-centered approaches that can be adopted within hospitals as well as academic institutions. So that is us. Yet again, we are located in Toronto. This is what we have been doing in order to address the problem. And I'm looking forward to chatting with you guys. So if you guys have any questions, please feel free to ask. Thank you.
Thank you so much, Joanne, for that informative overview of WombCare Clinic and the services that you offer. Very informative. And so we'll move on to our next panelist. And as we gather questions, we will pose them to the different panelists. All right, our next panelist is, let me get this open, give me one second. Jenny Rosenberg. Jenny, are you still there? Make sure we can hear you. Jenny?
Yes, I am here.
Okay, there we go. All right, great. So let me introduce everyone to Jenny Rosenberg. She is the Executive Director of Care About Fibroids. It's an international An internationally recognized leader in healthcare policy and strategic communications. Mrs. Rosenberg served for more than a decade in senior level policy and communications positions in the Obama administration and Congress. Previously, Mrs. Rosenberg was Director of Communications to former U.S. Surgeon General Dr. Regina Benjamin and former U.S. Assistant Secretary for Health, Dr. Howard Koh. Her broad experience as a regulator, policymaker, and communications expert brings a comprehensive, multifaceted approach to enhancing public awareness over public health issues. And without further ado, I'd like to hand the time over to Jenny Rosenberg. Thank you for being here.
Well, thank you, Sydney, and thank you to Abby and the Global Fibroids Alliance for including Care About Fibroids and me in this wonderful panel today. Several years ago, when Abby reached out to Care About Fibroids to include us in this global group, I never imagined it would grow as it has, and that we would be making the kind of impact and difference as so quickly. As other panelists had mentioned, this issue is something around the world that has not gotten enough attention, and it impacts so many women worldwide that it is going to take all of us and so many more to continue to push for policy changes that will lead to innovation and help women. So with that, I will jump right into my presentation. For those of you who are not familiar with Care About Fibroids, we are based in Washington, DC, and we launched in 2017 with a mission to elevate uterine fibroids as a women's health issue and to drive change. We've brought together many of the nation's most respected women's health advocacy and policy-focused organizations to advance solutions in the US. And we work very hard to increase awareness, push for research and better education about uterine fibroids. And our hope is that this will lead to earlier diagnosis and improved treatment for all women with fibroids. Some of the challenges that women are facing in the US, are just run the spectrum. But one of the things that Care About Fibroids has done over the past few years is really launched our own research into uterine fibroids to raise awareness about specific issues that women are facing. And one that I'd like to highlight is the very high cost of diagnosis, surgery, and treatment. Earlier this year, we released a white paper on the economic toll of fibroids for women. We found that the average woman who will spend tens of thousands of dollars on fibroids-related treatment. For example, she could spend $14,000 for the first year of fibroids diagnosis. Then let's say she has to undergo a hysterectomy, which is quite common for women in the US, and this could add more than $11,000 US to her cost burden. The financial toll can be even more burdensome for women who are dealing with pregnancy complications caused by fibroids, with costs ranging from $13,000 to even close to $60,000, depending on what a woman is dealing with. On top of all of these expenses, women are also facing lost income due to absenteeism at work. In fact, 75% of women living with fibroids end up sacrificing at least some of their professional life to deal with their fibroids. So the costs that I've outlined obviously highlight the need for more affordable, accessible, and non-invasive treatments. Since we were founded, Care About Fibroids has been working to address uterine fibroids on multiple fronts, with our core mission being close to advocating for women for increased awareness and to promote improvements for the diagnosis, treatment, and care of women with fibroids. This guides all of the work that we do and the pillars of our purpose, which are community action, research, and education. Obviously, in the US, we would love to see the situation improve for women. That includes driving awareness and finding more non-invasive treatments and lessening the financial burden so that women can more easily find diagnosis, improvements to diagnosis, and of course, racial equity on this issue. We were so pleased that in the last year, the US Food and Drug Administration has begun to approve oral treatments for the management of uterine fibroids. There's one oral drug by AbbVie and another one by Myovant Pfizer. This is very encouraging for the future of innovative therapies for women, and we hope that this is encouraging for other companies that are looking at getting into research and development around drug therapies for women. Women today need to have more options for uterine fibroids treatment, especially for women of reproductive age. Someone should not have to sacrifice their ability to have children just because they were diagnosed with uterine fibroids, and women need to have better options than just a hysterectomy. I would also like to add that we were very excited to start working with the White Dress Project as our patient advocacy organization partner to reach patients. And one of our greatest programs has been the Share Your Story program. So you can go to Care About Fibroids and share your story with us. We've found that taking these stories to Capitol Hill, to the media, has really helped drive home the picture of what it's like for a woman living in the US with fibroids. We hope that these stories will also make lawmakers and policymakers aware of the tremendous obstacles that women face, especially women of color in the US who may not have the same access to healthcare as other women in communities around the country. In addition to working with the White Dress Project, we are very excited about another patient-focused partnership called that we've started with a startup company called Responsum Health. And Responsum Health's mission is to empower patients and provide them with unbiased, up-to-date information on fibroids through their Responsum for Fibroids platform. This is a free service available online at responsumhealth.com/fibroids, or the app can be downloaded for free on the Apple or Android stores. The Responsum for Fibroids app or website empowers women with uterine fibroids through greater awareness, knowledge, and support. There's also a really great community chat on the website, and we know that one of the things that we've been trying to create more of is a community and find different ways for women to connect with who are living with fibroids. And I think especially during COVID, finding communities online has been really important to women. And all of the information that is on Responsum for Fibroids has been vetted and has been vetted by a team of doctors and nurses. And there is a patient advocacy board also linked to Responsum for Fibroids. So we know that the content that they're posting is geared toward patients and is all there to help patients. So with that, I will turn it back to Sydney, and thank you again for having me today.
Wonderful information, and thank you for all of the work that you and there are questions that are coming into the chat, so those who are posting, please just hold on to those. I'm going to make sure that I circle these questions to our. All right, for our next panelist, let me get this open for her, and I say this, if I say this incorrectly, I apologize. Korice Nancis is the founder and executive director of Fibroid Awareness Trinidad and Tobago. She's a reproductive health advocate, the living embodiment of combating fibroids with confidence, and a proponent of finding purpose even through pain. She has a strong background in communications, international development, nonprofit management, and leadership. In May of 2015, Korice was selected as a top 10 winner with her online fibroid-focused social entrepreneurship initiative, also known as Fibroid Awareness Trinidad and Tobago, and pitched for related feminine product and to action entrepreneurship challenge for sustainable livelihoods, the Global Partnership Coalition, and 1 million for 1 billion in Barbados. In 2017, as she continued to provide virtual support to women and girls and develop outreach designed as an international fellow by the U.S. State Department. As a fellow, she spent 5 months in the U.S. engaged in development training, refining the Confidence Project TT, and becoming certified in leadership. She then returned to Trinidad and Tobago to bring the Confidence Project to life and to launch and lead Fibroid Awareness Trinidad and Tobago. In 2019, she graduated from the University of Birmingham, UK, with a Master's in Science in International Development, and in 2020, she completed formal executive training in nonprofit management with the Arthur Lockjack Global School of Business, Trinidad. So without further ado, I'd like to turn the floor over to Ms. Korice. Are you there, Korice?
Yes, I'm here. Sorry about that.
No, it's fine.
All right. Good morning, everyone. Good morning, good afternoon. I'm not sure where we all are, but it's an absolute pleasure to be here to share briefly on the challenges in Trinidad and Tobago as it relates to women and for us even girls who are impacted by fibroids, what our organization has been doing and what we would like to see. And I also wish to echo the sentiments of the last presenter. It's an absolute pleasure to be a part of the global collective of fibroid organizations. For far too long, this challenge, which is one that affects millions and impacts not only women and girls, but also families, is one that has been kind of neglected. And I'm really happy to be a part of this as we heighten visibility and keep the conversation open globally. So I'm going to get into the presentation quickly. So we'll move to the next slide. Just to share who we are, Fibroid Awareness Trinidad and Tobago. We are a nonprofit and we're focused on the empowerment of women and girls through awareness, advocacy, and the support initiatives. And this is towards improved quality of lives. So our core focus at Fibroid TT are awareness and advocacy. All right, so in Trinidad and Tobago, three broad areas of challenges are holistic support, treatment options, or access to a wide range of treatment options. And because in Trinidad and Tobago, healthcare is largely offered by the public system or the state, there is a high demand and also limited research. And this is definitely not a problem that is exclusive to Trinidad and Tobago. We all know what it is like finding statistics as compared to other conditions that affect women and persons in general across the globe. So as it relates to holistic support, many of the women who come to Fibroid TT, they come because they do not have, they don't feel as though they get the necessary support through traditional medicine, and support includes all the information that they need to make the right choice for themselves. So because of that lack of support, they often shy away from seeking treatment because they feel as though the only option they have is hysterectomy. And also because that support is not grounded in complete education, there's a lot of misinformation in this space. And so late diagnosis is linked to this. And of course, because of the misinformation, a lot of women continue to suffer in silence because they don't have all the support and information that they need. Another challenge has to do with access to treatment options. There are quite a number of options that exist globally. In Trinidad and Tobago, the most prominent options are either myomectomy or hysterectomy. It's very difficult to find the other specialist options, laparoscopic or uterine fibroid embolization, the other options. And of course, again, because we have an information challenge generally, women don't have all the information that they need to make the right choice as it relates to treatment options. And of course, because our state provides healthcare, there is a high demand. A current theme that will probably run through today is how many women are impacted by fibroid. From the Ministry of Health website here in Trinidad and Tobago, one of their articles on fibroids, at least the only article that can be found on their website, and that's another challenge, but we'll probably talk about that at another time, is that as high as 80% of women present with fibroids. That's an extremely high number. Now, in reality, I don't know from the Ministry of Health if this number speaks specifically to Trinidad and Tobago, which I doubt, because we have been able to go into doing some research ourselves at various levels where the regional health authorities are concerned. Notwithstanding that, the demand is high, and because the demand is high, women definitely have challenges getting treatment through the public health system. And this also ties back into what our last presenter shared, the cost of treatment. The cost of treatment is a definite burden, and because they can't generally afford it privately, there is that high demand on the public healthcare system. And of course, as I mentioned, limited research. We can't find data that is disaggregated by region. And so as we move to the next slide, we'll share, how we hope to change that and what we contribute. So because we are not a medical organization, we are actually awareness and advocacy oriented. That is where our efforts are. We continue to keep the conversation in the public domain. That's what we do. We constantly drive awareness publicly. So we have regular webinars, we have regular sessions on the full gamut of how life can be impacted by fibroids. We have public education outreach where we go directly into schools, we go into the communities, and we also offer services where women, girls, even husbands, they come to us directly for information, support, what we call psychosocial support. And because we do have doctors that are within our support circle, and so we just provide as much information as we can. We do it strategically. We are very calculated in that approach. And of course, we also engage in fundraising so that we could support women who really need the financial support, whether it is for something as simple as a doctor's appointment or for treatment. Of course, some of our fundraising also goes to providing feminine hygiene products, which are costly. Of course, we've been seeing the conversation around, period poverty, also in the limelight. So we do our part in that regard as well. Next slide, thanks. Of course, what we hope to see globally, we really would love to see heightened visibility, and this includes comprehensive and sustained public education. At the country level, heightened visibility and comprehensive and sustained public education by the Ministry of Health. As I alluded to a bit earlier, accessing the Ministry of Health's website, we can't find information, and comprehensive information that could, comfort a woman, a girl, somebody impacted by fibroids. And of course, we want to see improved specialist resources that will positively change the capacity within the public healthcare system. And these resources are both human and capital resources. We would love to see that, of course. Also, we want to definitely play a more significant role in research, supporting research and getting the data. Because like our global counterparts, we know there are economic implications for women affected by fibroids. But the data, I think once we are able to get that data and present it, we can contribute to shifting the narrative and shifting, how fibroids are viewed, and of course, treatment and changing the lives and improving the quality of life to women in Trinidad and Tobago. Globally, of course, greater funding to sustain global research, support, and education. For far too long, this issue, which literally impacts millions of lives, has somewhat been neglected, overlooked, and we would love to see that change taking place. So that's my presentation in a nutshell. Fibroid TT, we are about awareness and advocacy, and we are committed to impacting positive change as it relates to information, research, and the support for women, girls, and families impacted by fibroids. Thank you very much.
Thank you so much, Korice, for that insightful presentation and for all the work that you're doing to, bring awareness and drive attention to this very funded area. With that, we will now open the floor for questions. I have a few questions that came in a little bit earlier. First, I will ask a few questions that came from the audience, as well as others that we've kind of already posed for the panelists. All right, so I think the first one is directed to Joanne, because this one came up during your presentation of WombCare Clinic. The question was, does your interdiscipline model plan include interventional radiology?
Yes, so we do liaise with OBGYNs and family MDs, and as they continue with treating patients within their scope of practice, we're actually able to help patients navigate specific questions that they could ask. So sometimes, unfortunately, the treatment options aren't available to them. So we really want to make sure that patients have all the options available to them and they have the right questions to ask their OBGYNs and their family doctors in order to get the right medical imaging and the right interventions as well. Yeah. Great question.
Thank you. Another question was directed for Jenny, essentially asking if you could repeat your contact information, but if you could place that in the chat, Jenny, that would be great. And that way we can make sure that that information is available to everyone. This is another question that's posed to all of our panelists. In your opinion, what is the most pressing issue that urgently needs to be addressed about fibroids in your country?
All right,
anyone can jump in at this point.
All right, so I can start. In Trinidad and Tobago, what needs urgent addressing, as alluded to, is comprehensive education on fibroids and treatment options. In Trinidad and Tobago, fibroids are still referred to as fibroids. Yeah, so even misinformation about the condition. Cultural inaccuracies have resulted in us believing that period pain is normal, so it's normalized. It results in late diagnosis. Women also self-diagnose. So they have heard about fibroids, and because they've heard about fibroids and they believe they have fibroids or somebody told them they have fibroids, they self-diagnose. Fertility issues, they self-diagnose. Challenges that if they have the correct information, they of course will not continue to suffer in silence. What I can also say is that because of the link to perceived infertility issues, you know, it's very taboo. But the reality is fertility, there's a contribution from men, there's a contribution from women. And of course, there's that other area, if we break it up into 3 parts according to medical statistics. And so one of the pressing issues for us is just information, correcting the misinformation in this space, because that will help to contribute to earlier diagnosis. And it would also take the strain and stress, particularly of women mentally, again, because you don't have the information, you suffer in silence, you take a long time to reach out, and you burden yourselves unnecessarily. So for us, comprehensive education is absolutely needed. That's a real pressing issue for us. And we also touched on it before, treatment options. We would recommend in that regard targeted education through the main provider of health services, that is the Ministry of Health or state providers. You see health campaigns for other areas. Fibroid and general reproductive health is an area that needs some more attention. And that's it for us, because we see it daily, the misinformation and the just absolute fear because of the misinformation. And that's why we were founded. In fact, when I was diagnosed at a very young age, I was 19 when I was diagnosed, I could not find any way to get information that related to Trinidad and Tobago, information in general. And this was quite a time back. And so that was really the genesis of this entire movement. I couldn't find information because I'm an information junkie. This just became the natural next step, sharing information and providing support as an empath, So that's my response.
Thank you, Korice. Joanne, would you mind jumping in, and then Jenny?
Yeah, so Korice, you said it so well, and I loved, and I'm just going to echo everything that you've just said. There is a huge cultural component when it does come to uterine fibroids. So at this point in time, within Canada, especially within specific BIPOC or Black, Indigenous, and people of color populations, the symptoms of uterine fibroids have almost become normalized. So we know that uterine fibroids is common, but we do not want the symptoms to be normal. So we really want patients to be able to understand the educational component regarding fibroids, as in like the location, where it is, the symptoms, preventative measures, and also what you can do in the meantime as you're waiting for specialist appointments. So that to us is huge. So we know that there's a lot of lifestyle changes that could occur in order to help decrease some of the symptoms of uterine fibroids. So I know that there were studies that were performed talking about the benefits of vitamin D, and also in terms of the benefits of EGCG or EP, I'm not going to pronounce it, it's quite long, which is found in green tea. So we know that these things in terms of diet, physical activity, hydration levels, sleep levels, mindset, meditation, all of those things are really important in making sure that women are able to not just survive, but actually thrive. And then right now within Canada, because we do have a beautiful healthcare system, there is a huge wait time for specialist appointments and for OBGYN consults as well. And we do find that sometimes the options are not completely presented to women. So in terms of uterine sparing options, that's not really addressed as much as we would like right now. So we know that there is some fantastic work being done on uterine artery embolization. We do know that there are different types of laparoscopies that could occur in order to help. It doesn't have to be the first step, it's a hysterectomy. So we really want to be able to arm the patients with information and knowledge and education, because we're not just trying to impact them positively directly, but also generationally as well. So in order for them to tell their children and children's children that these signs and symptoms, yes, they're common, but they're not normal, and there is something that can be done about it. Yeah.
Thank you, Joanne. Jenny, any words to add?
Well, I just want to echo everything that my co-panelists have mentioned. What really resonated with me, just the remarks that Joanne made when she said, we want women not only to survive, but we want them to thrive, and that we want to arm patients with information, knowledge, and education, not only to empower themselves, but also to help generations of women. And we want this conversation to be more common. And for us, part of doing this, part of achieving that goal is raising awareness about uterine fibroids, because so much of this of what happens to women when they have fibroids happens in silence. And that is how this condition has been socialized. And so, for example, we had some other work that we published in 2018, a white paper on the condition and its impact on women in the US. And we illustrated the disparities around women of color and how they, for example, their hospitalization rates are 3.5 times higher than white women, and that they are more 2.5 almost times more likely to undergo a hysterectomy. I think when this is part of the conversation, and again, this is why I love the Responsive for Fibroids app, because it brings women together in a very accessible way. They can talk about how their fibroids are being treated, and maybe they're going to a doctor that has always treated fibroids with a hysterectomy. But we're very excited about options for women, whether it is UAE or it's an oral therapy. But we want women to be able to know that these treatments are out there, so that, again, they can survive, not just survive, but thrive, but also share this information with other women. And part of that also here in the US is getting the funding for research and education around uterine fibroids. And there is legislation that has been moving through the Congress. And we're very hopeful that maybe in the next Congress or two that this will actually become law, and will put money in the hands of the federal government researchers who can do some work around uterine fibroids that will really help women here in the US.
Thank you, Jenny. Our final panelist was able to join us, so we are excited to move to that before we run out of time for this portion of the discussion. So I'm going to go ahead and introduce our fourth panelist, if that's okay with everyone, Shelly-Ann Weeks. Shelly is the founder and executive director of the HerFlow Foundation, which was established to empower women and girls about their reproductive health through education and mentorship. One of HerFlow's main objectives is to end period poverty in Jamaica, starting with public schools. Shelly-Ann is also an author and activist with a background in marketing and public relations. The focus of her work has been female sexuality, where she teaches women how to become more sexually confident. She also works with girls to help them better understand their bodies by helping them prepare for puberty and understanding menstruation. She's the author of I Changed My Diet and Changed My Life, and It's My Body, period. So without further ado, we are going to hand it over to Ms. Weeks, and she will do her presentation as well.
Good morning. I'm trying to find the camera so I can turn it on. I'm not quite sure what is happening. Can you hear me?
Yes, we can hear you just fine.
Yeah, let me just, so Shelly-Ann, I'm just going to see if I can promote you so that you can share your slide. I think you should be able to share now. I'm not share, sorry, do your video.
Start video.
I think sorry to interrupt. I
think you should be able to see me now. I'm trying to start the video. It says I cannot start the video.
Okay, go for
recording.
Sorry, I think it's because.
Okay.
Right.
There I am. Good morning, everybody.
Good morning.
Let me first apologize. It appears I'm late. I think I had a time issue in terms of what time of day it is. It is still 10 something in Jamaica, and I was looking for 11 o'clock. So I apologize. I didn't realize you guys are an hour ahead. I just wanted to talk a little bit about fibroids in Jamaica and how it's affecting Jamaican women. Jamaican women are typically our culture embraces us having a lot of weight on our bodies. We like women who are voluptuous and curvaceous and has the big breasts and the wide hips, and so we have a lot more fat on our body than European women, or even some of the other cultures. If you look across the world and how we culturally we are. And based on what I understand about fibroids and reproductive health issues across the board, is that the size of our bodies are actually helping to cause us some of the challenges that we are having, especially reproductive, when it comes to reproductive health. When you look at the number of hysterectomies being performed in Jamaica, and this is anecdotal, of course, because one of the challenges that I have as a foundation is that there isn't any research in reproductive health that we can draw on. As a matter of fact, I am currently trying to find funding so that we can commission research on reproductive health in Jamaica, because I really do believe that the numbers are very, very high, just based on the anecdotal evidence that the numbers are very high as it relates to the number of women who are affected by reproductive health issues. And I'm talking about fibroids, endometriosis, polycystic ovarian syndrome, the whole gamut of the reproductive health issues. But I don't know if this is the case in the United States, or maybe some of the panelists can vouch for this, but the two of the more popular reproductive health issues that we see here in Jamaica is fibroids and endometriosis. And some women have both. And you can just imagine the sort of quality of life that they get to have, based on having to deal with all the pain and the severe symptoms that come with having, such severe reproductive health issues. Part of our mandate as a foundation at HerFlow is education, education, education. So even in our conversations that we have in schools with young ladies as they are just experiencing periods for the first time, we try to get them to get in the mindset of knowing that their choices that they make in their youth can affect them when they get older. So we start to get them thinking about their lifestyle choices, the foods that they eat, including exercise in their daily activities, ensuring that they get good sleep each evening, being mindful of the kind of products and stuff that they use on their bodies, because all of that adds up. And what ends up happening is that a lot of women do not know that they have reproductive health issues until they're trying to reproduce. And that is when they realize that they are diagnosed with something that is causing them to have challenges reproductive wise. As it relates to legislation, the truth of the matter is that misogyny is still a thing, and the laws are made mostly by men in Jamaica. And the truth is that reproductive health issues, female reproductive health issues, is not on the agenda. I wouldn't even say it's not a priority. It's not even on the agenda. And it's not for a lack of trying. Myself and other NGOs have been trying to get the attention of the health ministry. We have a program in Jamaica called the National Health Fund, and it's designed to help persons who have certain illnesses benefit from cost, from discounts and different cost benefits that they can get whenever they get diagnosed with certain things. And we're trying to get fibroids and other reproductive health issues listed amongst those illnesses. Right now, the Health Fund looks at diabetes, hypertension, asthma, with different illnesses like that, but reproductive issues are not amongst the listed items. And I really do think that it should be, just because of the amount of women in Jamaica that are facing these challenges. Another thing that I will say is that the education is so important, because a lot of women end up doing hysterectomies as young as in their 30s, even in their late 20s, just because of the severity of their syndrome. And it is being looked at as the only way that they can get some relief. And while I believe that hysterectomies are one of the tools, I don't think that is the only tool. And it's almost the first thing that the doctor tells you whenever you are diagnosed with fibroids or even endometriosis. First thing they ask you is, do you have any children? Do you want children? Because you can't just take out the womb and just be done with it. And while like I said, I know there's a place for hysterectomy, I am very hesitant whenever I'm looking at removing an entire organ from the body for most of your adult life and the repercussions that come with that. So I think that the conversation needs to be a lot more nuanced. And so, you know, when I talk to doctors here in Jamaica, and like I said, this is also anecdotal, but when I talk to the doctors that I work with directly, they are telling me they're doing 2 to 3 hysterectomies a month. And if you add that up in some sort of frequency, if you say, all right, so that's 10 doctors, that's 30 hysterectomies a month in a country where it's 1 point change million women, where I mean, you know, that sounds very high to me. But like I said, until we actually know the empirical data, it's difficult to put a quantity on it. But it is my opinion, just based on the work that I have been doing, that the numbers are a lot higher than we think it is here in Jamaica. And I am actively seeking the funding to see if we can have that research done so we can see how many Jamaican women and girls are actually affected by reproductive health issues. I'm not quite sure how much time I have, so I'm just going to see if I can check in with the host. Hi. And I just want to say a big thank you to Lake Health and Wellbeing for putting together this conversation, because this is absolutely integral, especially to Caribbean women, because we are affected by these different illnesses, and they don't just affect us, they affect our families, because you know how it is. When the women are sick, the entire family feel it. That's just a fact.
Exactly. And thank you, Shelly, so much for Shelly-Ann for your details and talking about some of the barriers that you're facing in getting this topic on the agenda at the legislative level, as well as, you know, at the level in which health departments and public health identifies it as something that's necessary to be focused on. We are running up against some time, and we want to make sure that our next panelists have the same amount of time to have their discussions. So at this time, I will thank all of the panelists, all of those who have already posed questions. We still do have those questions. When we open the floor again for questions again later, we will try to add those questions and allow all of our panelists to respond if we have the time. So now I believe we're going into a short break. During this break, I will be playing a very short video. You know, this is time that you can, you know, take some time and grab some water, go to the restroom if necessary, or if you're just looking to gain some more information about fibroids and some of the information that's available to the public. You can stay and hang around for that. Yeah, and so at this time, do I pass it over to you, Abby, or do I need to just go ahead and share my screen and put on the video or play the music?
Yeah, hi everybody. So thank you so much to the panelists. So we'll break for 5 minutes, like Sydney said, we'll break for 5 minutes. So I say it's roughly about 12 o'clock. So we come back about 12:05, and then we'll hand over to the second panel. And if you have any questions, comments still, you can put them in the chat and we'll aim to get to them at the end. And so I will let Sydney play her video. But in the meantime, feel free to relax for 5 minutes and we'll get started about 12:05.
I was diagnosed with fibroids around the summer of 2015. I got diagnosed with an autoimmune condition, and then maybe a few months later, I got diagnosed with fibroids. I had 2 small ones. I knew something that may have been wrong because I was having heavy periods for a while, but I just, you know, I didn't think it was a big deal. So when I was initially diagnosed with fibroids, they were 2 small fibroids, and then they kind of morphed into one larger one over time because it just started to grow and get bigger. So, it's becoming a bit of an issue, especially because I would like to have kids in the next couple of years. But then I also read stuff online where women are like, oh, my fibroid was, 15 centimeters and I had a healthy baby. And then I went vegan and my health improved dramatically. When I went to get testing again, then I had low iron. It's just like, it was like never ending. When I went to this outdoor fair this year of 2019 in Brooklyn, there was this Black woman there. She was like a tea practitioner, I guess. She had like various herbal concoctions for different conditions, one of them being fibroids. And she told me to keep drinking it. I felt fine, who knows if it was working, but she did say that a lot of her patients have seen a reduction in their fibroid tumors and have had easier pregnancies. But the reality is I have to put my health first. So I think that, I can't just do this by myself, and I have to get to a point where I get support. So that's something that I definitely want to address by the end of this year, like finding a way to get support so that I can maintain veganism or at least some sort of plant-based diet, because I felt so much better and my periods were better. And like I said, I really do believe that they've gotten smaller once I was vegan.
Hi, I'm Dr. Naika Pickering. Today we're going to be talking about natural remedies for fibroid management. Black women tend to suffer from fibroids a ton in society. It's something that's really prevalent, and I see it in the office all the time. When I'm managing a fibroid case, I like to make sure that you're getting really comprehensive care. So the first thing I like to make sure you have is actually a gynecologist, somebody who could order imaging and do the lab work. And then from my perspective, I will treat from a more holistic lens to help you feeling better, because you don't have to suffer with fibroids. There is a way to manage it. When we're in the treatment phase, we tend to be more aggressive. We really want to get your body to a state of balance. We really want to flood your system with an abundance of nutrients. So whether it be nutrients or herbs, that's how we target treatments. Once we get you to a place where you're more steady and you're starting to feel better, your symptoms are reducing and you're feeling more vital, we tweak the treatment a little bit to be more conducive to your everyday lifestyle. So you won't have to take as many supplements or make as many changes. You're sort of cruising. Yeah. I like to focus on diet a lot, because we know that inflammation is really something that helps fibroids grow. So we want to tone that down a lot. So we could work on getting you into more of a plant-based lifestyle. I like to reach for more of a pesco vegan diet. So that looks like eating a ton of fish and vegetables and fruit, and kind of lowering the grains and the sugar, even though that's hard because it tastes really good. But fibroids tend to grow when there's more inflammation in the body. So that's more of the diet side. My clinical interests have always included hormonal health. It wasn't until I opened my practice last year that I kind of tailored my specialty to what was being presented in front of me. So I was presented with a lot of Black women coming in for women's health issues, especially infertility and fibroids. As I delved more into those cases, I got more comfortable with treating them, and then people would refer out and then bring more people in for infertility and fibroids and other women's health issues. So in that way, that's how it became my specialty.
Right, so that was our break. I believe we have about 2 more minutes until we have to return. We also chose that particular video, not necessarily because we're endorsing a particular provider or organization, but because we wanted to kind of round out our discussion, because we're, oftentimes we do spend a substantial amount of time discussing the surgical benefits or some of the non-surgical treatment options that are available for uterine fibroids. And so we wanted to kind of expand that conversation to look at it from a more holistic viewpoint. All right, and so now I believe we have maybe 1 more minute left. Abby, did you want to jump in here? Do we ready to get started, or do we want to wait until 12:05 your time?
Well, it says 12:05 my time, so we can get started with the second panel. So welcome back, everyone. Welcome back. Thank you for sticking with us. So I am not going to say too much. All I'm going to do is say I am very pleased to introduce the moderator for our second panel, the very wonderful Candice Bryan. Candice is the founder of Noir Wellness, a community company established in 2016 to reduce health inequalities and improve the health and well-being of the African Caribbean community living in the UK. She holds a bachelor's degree in leisure management, is currently studying for her master's in public health, and has an established career that spans across the inclusive fitness, sports development, and public health sector. She is best known for creating community wellness hubs, inspiring and supporting new and upcoming wellness practitioners, and delivering engaging talks. Her efforts to support women with fibroids have included hosting an innovative, culturally appropriate and holistic annual fibroids wellness series, and that was recently transformed in 2021 into a powerful 12-week online fibroids program. Candice has always believed that cultural identity has everything to do with wellness, and her personal mission to create a legacy for her children, wider community, and generations to come directly translates to the projects she engages in, extends support to, and continues to show her commitment to. So without further ado, I hand it over to the wonderful Candice Bryan. But first, I must say a big thank you to Sydney for moderating so well the first panel. So thank you so much, Sydney. And now over to Candice.
Thank you so much, Abby. And thank you for inviting me to moderate our second panel today. And once again, thank you, Sydney. That was an awesome first panel. I am blown away with just the sheer volume of activity that is happening across the globe. And I think, you know, I'm truly humbled to be part of this movement. And I'm really excited to see what we are actually going to get out of this. So I'm not going to go on much. I'm just going to go straight in and introduce our first panelist. Dr. Stacey Bryan is an obstetrics and gynecology registrar subspecializing in women's cancers. She obtained her undergraduate degree in biomedical science and medicine at St. George's University of London in 2008. And she's a member of the Royal College of Obstetricians and Gynecologists in 2015. She's been working in her specialty for some 12 years, and she has undertaken research looking into prevention and early detection of cervical cancers. Her work has led to publications and presentations at both national and international conferences. Dr. Bryan is also the Vice Chair of the British Caribbean Doctors and Dentists Association, otherwise known as BCDD. She is also an advocate for health awareness in literacy and in the community. She has worked closely with charities to provide education surrounding women's health, particularly to those marginalized in society. So I'd like to welcome Dr. Bryan to the panel, and I'd like to hand over to yourself. Dr. Bryan, are you there?
I'm here, but I'm unable to start my video for some reason.
Okay, I think Abby is in the background and she will sort that for you. Welcome to today's panel, Dr. Bryan, whilst we get that sorted for you. It's a pleasure.
Oh, sorry.
Thank you so much, Abby. It's a pleasure to have you here on board. Over to you.
Thank you very much, Candice. Thank you for that brilliant introduction. Excuse the background, I'm at work. Hopefully no one will disturb me whilst I'm giving my presentation. But thank you all for the invite, and well done to all the panelists so far. The first session was really, really insightful, and I'm grateful to be on this platform. Just going to share my presentation. And I'm hoping everyone can see that. Oh, hello. Can everyone see?
Yes.
Right. So thanks. Yeah. Excellent. Thank you very much. So firstly, just wanted to talk about the challenges, and my talk is more so from the medical point of view. I think a lot of what I've mentioned in this slide has already been mentioned by other panelists. So one of the challenges is that a lot of Black women suffer from these symptoms symptoms for a very long time. So very long-standing symptoms. And I think someone already said it, that should be normalised, basically. Heavy period normal, particularly if it's affecting life and working, etc. So, you know, people do present a little bit late or fearful of coming to seek help from the health, whether that's language barriers or whether, again, that's that whole aspect of not wanting to talk about your symptoms, not wanting to kind of speak to anyone about what's going on. You feel like you're the only one that's going through it, and you often find that the women are voiceless because of it. Some women may also, from talks that I've done before and conversations with other women, is that they feel less empowered to come and have conversations with healthcare professionals. And lastly, I've put ignorance in capital letters, and ignorance in the sense from the healthcare professional side as well, not so much from women who have fibroids. Actually, I find that a lot of women have read quite a bit about it, and it's actually us as healthcare professionals, unfortunately, that are ignorant to it. If I can, and if I do have some time, I want to share a quick anecdote, for example. So being an obstetrician and gynecologist, or OBGYN, I obviously look after women from a gynecological point of view, but women in their pregnancies also. And again, someone has also mentioned that, you know, fibroids can be a problem in terms of falling pregnant, but also in pregnancy as well. One of the most common things that happens is what we call fibroid degeneration, which can cause intense pain during pregnancy, particularly as the pregnancy goes on. And I was working in a particular unit on the labour ward where unfortunately they don't deal with many black women. It's a particular area in the UK where they don't see many black women. And this poor African woman has come in to checks the baby, the heartbeat's fine, the tracing of the baby's fine, the woman's observations are all okay, they did blood tests, and then one of my colleagues, who happens to be another black doctor, to come and review this patient. And my colleague said to me, the comments at the station were things like, you know, everything's fine, I don't know why she's in pain, why is she in pain, everything is fine, I think she's just seeking attention, or something towards that kind of language. And actually, you know, we overheard this, and we sat this midwife down and said, look, no, there is such a thing as fibroids in pregnancy. It can cause intense pain. Women often need to be admitted. They often need to have morphine even. He just showed me that, you know, some of us as healthcare professionals are not understanding it. We're not getting it right. We sat down with her. We basically did a teaching and a tutorial with this particular midwife, and then also set up a teaching session for other midwives to be able to kind of make them aware that this is actually a thing. It's not a woman that's just seeking attention. So how are we addressing these challenges? So as Candice has mentioned, I am the Vice Chair of the British Caribbean Doctors and Dentists Association here in the UK. And we are in the process of being registered as a charity. We were set up about 18 months ago. Initially just trying to get together doctors and dentists and medical students of Caribbean origin over here in the UK, just together to support each other. And actually over the past year and a half, there's quite a few things that we now do as an organisation. One of them is outreach into primary and secondary schools and trying to encourage young people into medicine, and sort of helping them through applications for medical and dental school, and also for doctors or students that are already in the process. We are also encouraging, we have a professional development program where we're encouraging members and doctors to try and kind of rise along among the ranks within the NHS and within healthcare, because we actually strongly believe that, you know, our health system should represent the people that we're treating. And again, just the story I told just now, you know, already shows that if we have the knowledge, we know about the things that us as Black women suffer from, so we're able to educate others who may not know. And I think we need more of us in these types of organisations. And one of the other things that we do is we have monthly health promotion events where we have certain topics every month that affect the Black community that we put on. And it is largely sort of doctors, healthcare professionals. It's addressed to the general public. They are free webinars. They've been webinars because of COVID, obviously. And they are addressed to the general public. And this topic in particular, we performed on the 25th of July. We had a fibroids discussion. My colleague, Dr. Pickard, who's an obstetrician, treatment options. And again, another theme that's been running through the high rate of hysterectomy or surgical options that are being offered. Should not be the case. It should be the last resort, really. So, you know, we're just talking to women about that aspect. We had a registered nutritionist. And again, I've seen in the chat, there have been a few people ways, holistic approaches to managing fibroids. And we had an absolutely fantastic nurse who's actually a patient. She had just had her myomectomy, which is surgery to remove her fibroids, and she assessments, the discussions that she had, what to expect on the day, what she expected after the procedure, and also the recovery after her surgery. Did and it's on our YouTube channel it will be put on our YouTube channel quite shortly, so if anyone is interested, you can follow us on British Caribbean Doctors and Dentists Association. And lastly, global improvements. I think, again, what we're doing right now, actually networking and collaborating and, you know, being invited to such platforms as well to be able to speak and share our ideas and our knowledge, I think is a great thing to do. I've also worked closely with Candice as well on her Noir Wellness Fibroids program. We had a joint BCDD event as well quite recently regarding that. And I think that's important, more networking and collaboration. More education, as I said, not only women who have fibroids, and again, we are all about increasing health literacy and empowering women, and, you know, just letting them know the difference between things like going to your GP, what your GP would advise, rather than or compared to going to a gynecologist. And understanding what a gynecologist can do and what the limitations of a GP are. Actually saying to your GP, if you're not happy, I want to be referred to a gynecologist. Presenting all of the treatment options available so that if you do try one and it doesn't work for you, go into the GP or gynecologist and say, look, I've tried this, it hasn't worked, I want to try this now, rather than relying on that person to tell you or not, as it so happens, what the different options are. And as I said, also educating other healthcare professionals. And this is why I like being involved in these types of platforms, because it's good to hear from others, you know, what is being done, what can be done, and what is out there. And then lastly, I think, again, it's been touched on, so funding and more research as well, and studies. There has actually been a suggestion that fibroids has a genetic component, that about up to 50% has there is a chromosomal abnormality that has been identified. Again, just doing a quick search, there's not much that I can see in the way of this being, you know, well known. There's not much in the way of, well, do Black people have this particular gene, for example? Is that why we're more, you know, we're more likely to develop this, and we're developing it at an earlier age? So again, more research, more studies, and I think more funding needs to go into fibroids and its management. But that's it. Thank you very much for listening. If anyone wants to follow us, contact us, send an email, then please do. These are our details. Thank you.
Thank you so much, Dr. Stacey Bryan, and it's always a pleasure to work with you. I do understand you are in clinic, so at times, you know, the bandwidth of the internet, we couldn't quite catch you, but just for everyone listening, you will be able to replay this webinar and also connect with BCC and Dr. Bryan and her phenomenal team. I found it really interesting, the point you made about, you know, ensuring that healthcare professionals sometimes aren't educated about fibroids, and that's one of the things that we need to certainly address. So thank you very much, Dr. Bryan. We will come back to you shortly. So my next panelist is Elizabeth Korasare, who is currently the CEO of Real Opportunities Network, a non-governmental organization focusing on health education on HIV/AIDS, tuberculosis, pneumonia, and non-communicable diseases, including uterine fibroids. And she doubles as the founder of Fibroid Foundation Africa. Elizabeth is a victim of fibroids. She had on 2 occasions removed fibroid tumors, and this is one of the reasons she started Fibroids Foundation Africa, to provide support for women in her community suffering from this overlooked disease. As part of her work, she engages in advocacy, communication, and social mobilization activities. It gives me great pleasure to introduce our second panelist, guest, Elizabeth. Are you there?
Yeah, I'm here.
Welcome, Elizabeth. Over to you.
Thank you. Thank you very much. I'm happy to be part of this global discussion, and I wish to express my deepest appreciation to Abby and her team for not leaving Africa out, and for that matter, Ghana, and for that matter, Africa out. We are very, very grateful. At least you hear what we are also facing in Africa. Well, just as you have said, I'm a victim of uterine fibroid. The first one occurred before my first child, and it nearly led to the termination of my pregnancy. But then I sought a second opinion from another gynecologist who placed me on some drugs, and I was able to sustain the pregnancy till its full term. The second one occurred 18 years after. And even after the diagnosis, I lived with it for 6 good years, because it was a very difficult time for me, taking decision as to what I should do, because all the doctors were suggesting a hysterectomy, and to me, I didn't like that. So I have to live with it for over 6 years, until one day I met a doctor who just told me that I was carrying excess baggage, and so I should go and get rid of it. So really, I had to go in for the surgery eventually. Then it was during the surgery that I realized that the number of women in that hospital with me in the same ward were all there because of fibroid. Then I asked myself a lot of questions, because even my doctor who took me through that surgery didn't tell me anything about the condition. So I started investigating, started looking for information, and with what I gathered and with the scanty information we have on Africa, I decided that it's a good opportunity to help other women. So I stepped in to start Fibroid Foundation, and we've been around for the past 2 years. But we are happy and to say that in May 2021, that is 23rd May, we successfully launched Fibroid Foundation. And Fibroid Foundation exists to be there to support, love, and care for women suffering from uterine fibroids. And also, we are committed to be the voice of the voiceless, and ensuring that women are well informed about uterine fibroids, meet basically their emotional needs and their spiritual needs during the time of treatment and after treatment, which is very important when it comes to our world here, because we believe a lot in spiritual issues. So having spiritual support is very, very important. And finally, we also seek to educate, advocate, and carry out research, because for Africa, there's nothing much to read when it comes to fibroids. So, going to my presentation, challenges faced by women living with fibroid. In Ghana here, accessing medical care is very critical. Please, can you see my screen?
No, we can't see your screen as yet. Are you able to share?
Yes, I clicked on share, but I don't know.
So if you click on the green button,
yes,
share screen. Here we go. Yes, we can see it now.
Okay.
If you go to the, yes, from the beginning.
Okay,
Lovely.
so accessing affordable healthcare is a big challenge to women here in Ghana. And it's because fibroid surgery is very, very expensive. When you look at the cost element, it ranges between $300 and $1,500. But then it depends on the facility where you present your case. You might say $300 is no money, but if we talk about the people, most of our women live in the rural areas because most of them are engaged in farming. And to raise $300 to cater for a surgery is very, very difficult for some of them. And so we find that most of these our women become so vulnerable and they go about seeking for treatment from all over the place. They go in for alternative treatment, people lie to them and they go in for alternative treatment. And that is also very, very expensive. It leads to other complications. They have physical complications, emotional complications, psychological complications, and financial as well. And you find a lot of women who are anemic. They are anemic, and some of them even collapse. And I have come across so many women who will tell you that the prolonged bleeding is affecting their quality of life because some of them go to work and they cannot even sit down. They have to stand for hours on their legs because when they sit down, they'll soil themselves. And it's also unfortunate that we have pastors around here who peddle that some of this fibroid is a spiritual disease. And some of the women who are carrying fibroid is because they have spiritual husbands. And for that matter, when it's a result of sleeping with your spiritual husband. So indeed, if the person has this information, definitely the person will not go in for even the orthodox. The person will be looking for a spiritual solution. And that also becomes very, very difficult for the women. And then they have the fear of surgery because they hear stories around. Unfortunately, some people lose their lives when they go in for fibroid surgery. And for that matter, people are afraid. And also losing a womb is also not an easy thing because there are so many religious or cultural beliefs that people they have internalized, and it becomes very difficult for you to change their mindset when it comes to even their treatment option. Going on to share with you the best practices, I think we should look at collaboration between the orthodox and alternative treatments. Both groups stand at different positions. The orthodox will tell you that it's only surgery. The alternative treatment will also, providers will also tell you that there are other alternatives, there are other concoctions that you can take to bring some solution. So if there's a collaboration, at least there will be some seamless link that will help them to work together. Then we who are supporting this this course will be able to determine, or the doctors will be able to determine who needs what at what times. So it's very important that there's a collaboration between the orthodox and the alternative treatment people. And also fibroid should be seen as a reproductive health concern. One of the panelists indicated that it is not even part of reproductive health issues. And it's all over. Fibroid is not listed among the reproductive health issues. It should be a reproductive health concern to all nations because it is wreaking havoc on women. Women are losing their wombs. They are losing their joy. Women are losing their husbands because of fibroid, because most people are affected infertility issues and they are unable to give birth. And for that matter, they are sacked out of their homes. I have a lot of stories I can share with you. I have a lot of faces I can show to you, women who are suffering because of fibroid. So we should not push it under the banner. It should be one of the key issues because we need the womb to procreate and to make life continue. So if the womb is affected by anything, it should be very, very important to everybody listening or everybody in key position. Because without the womb, there will not be any population, there will not be any family. So if women are losing their wombs, it should be of greatest concern. And I also think that there should be partnership and collaboration for research. I heard all of us are talking about research. But the research to what extent? Because when it comes to malaria, HIV, AIDS, research cuts across every continent. Everywhere you go, there are teams that are even sent by World Health Organization to go to countries to research on some of these diseases. What about fibroid? We should also be looking at that. And also you walk to offices, departments, areas, hospitals. Sometimes you get flyers on HIV, on malaria. We don't see that around when it comes to fibroid. So it's also very important that we develop IESC materials that keep people what is important to learn about uterine fibroids should be put together in a booklet to be presented everywhere. Then looking at the global intervention, I think there should be commitment of political leadership. It's very, very important. If our leaders are not committed to this cause, we cannot reach anywhere. Because when you speak and the person listening will not accept what you speak, you say, then you are just hitting the side of the drum. Recognizing a month for awareness creation activities and screening of the at-risk population is very, very important. I know that in the US, somewhere in the US, July is set aside for fibroid awareness. But I think World Health Organization hasn't bought into that yet. So for that matter, it is done by few people. Wherever we have Malaria Day, we have TB Day, we have whatever day. HIV Day, we have whatever day. So we should see fibroid as key part of reproductive health issues and set aside a month. World Health Organization should come out with a month. If it's not July, they don't like July, any other month. And let's celebrate the month. Let's go about creating awareness, screening our youth. Young girls, because now it's affecting young girls. One of us said she was diagnosed at 19, which means that it's not her alone. It's all over. Young girls are facing it as well. They wouldn't know until after their weddings. And after the wedding ceremony, they come home and after 3 months, they are unable to conceive or they might have a miscarriage and they go back to the facilities or clinics and they are told that they have fibroids and it hit them like a blow. And some of them come, they don't know what to do with themselves. They don't know how it came about. Some even go about accusing their parents for whatever reason, I don't know. And also there should be sourcing of funds to aid research, just as we have said. Funds to aid research and affordable treatment, especially in our part of the world. There should be some affordable treatment because I have a lot of women on my list. Why are they still there? Because they are looking for affordable treatment. But then we have few facilities that take our national health insurance. And even if with your national health insurance, you have to pay half of the cost. So you can imagine if the cost is $300 and you have to raise $150, it is not easy for some of them. So they live with it and they are unable to take decisions, make their own decisions as to what treatment they can afford. And there should be strong advocacy, which we are doing in here, but we haven't reached far because we do not have data. And just as we said, without data, we cannot move forward. If we are unable to tell the medical community that maybe 600 women undergo fibroid surgery in a month and 600 or 500 wombs are being taken away, we cannot do much because to them, it's another channel of making money. Because if the women come, they will charge them and make their monies, not thinking about. So fibroid in Ghana is seen just as an ordinary women issue. So any woman making fuss about fibroid is just ignored or pushed aside. You know, it is just an issue. It's just you bleeding. It's just you are in pain. You know, so I will end here for any further questions or contributions. Thank you very much.
Elizabeth, thank you very much. That was just such a powerful presentation. You have stimulated so much conversations in the chat. We have been discussing funding, the need for funding, the leadership. You actually ended on the strong advocacy, and that's what you've displayed here this evening. Just phenomenal. So thank you very much for your presentation. In the interest of time, I'm going to move very quickly over to our next panelist, and then perhaps I'll pause for some questions. Thank you once again, Elizabeth.
Okay, thank you. It's my kind.
Our next panelist is Imani Sorhaindo, who is the founder of KMT Rising Limited, and also the co-director of Be Me Like We, a qualified holistic health practitioner, teacher, and event manager who centers her life through the filter of a Syrian way of life. Much of her work is focused around one-to-one and group consultations and practical therapies for women with fibroids and other health-related challenges. Her services support women to take more time to self-care, heal from trauma, recenter, refocus to ensure that they stay well. Some of the range of holistic therapies offered include guided imagery, acupuncture, breath therapy, mindfulness, and energy work. With over 30 years of quality assurance and teaching experience, Imani creates and delivers her own regular online courses in mindfulness, energy balancing, confidence and communication, and facilitates monthly Black Sisters Womb Wellness sessions in Suffolk, South London, and online. Her most recent program, the Womb and Series, is an online interactive series on fibroids and how to heal them using holistic strategies. This series was born out of her 2019 lecture in Dominica at the University of West Indies, where she spoke on the subject of fibroids and its impact on Black women across the globe. Imani will be publishing her own book on nature's pathway to healing fibroids later this year after her own 15-year journey of transforming her life through the shrinking and healing of her own fibroid symptoms. It is with great pleasure that I introduce our next guest panelist, which is Imani Sorhaindo. Over to you. Thank you.
Well, thank you so much, Candice. It's truly a pleasure to be here this afternoon. Welcome everyone, and welcome listeners and panelists. Yeah, where do I start? It was really quite a challenge to drill it down into 10 minutes, so I'm going to give it my best shot and just share. And thank you, Abby, and the rest of the Global Fibroid Alliance. It's truly an honor and a blessing to be part of such a powerful, dynamic alliance that is really doing some fantastic things across the globe. For me as a practitioner, I thought, let me bring it home, because we've had a lot of facts around what are fibroids and so on. But for me, it was around my own experience as a practitioner, working with clients primarily across the UK, in the sunny rural Suffolk, but also across the cities as well. And what we find there are some emerging sort of themes that, we can all sort of testify really. These are some of the things that I'd like to pull out from my own experience. Many clients, many women not feeling listened to or unable to discuss the issues around fibroids with their loved ones. So I know some of the practitioners spoke about not being able to speak to, their GPs and their practitioners, but also sadly, many are not able to speak and share it with their loved ones, those most close to them in the family situation. Sometimes a profusion of information and sometimes little information. So you've got these two extremes. Some Black women, I work primarily with Black women, find that there's just so much, an abundance of information about fibroids online, and they don't know what is fact and what is fiction and what are myths. And yet you have the other extreme some Black communities I work with because of language barriers and literacy challenges. Sometimes there's actually little access to information as well. All of the women I've worked with have felt that they are unsure about what choices to make. And I guess that's why they come to someone like myself in the first place. They really do not know what to do, where to go, and what choices to make, and what are the pros and cons for them. And then there's the physical, some of the symptoms around back pain due to the bulk of the fibroids, managing heavy bleeding and clotting, you know, the hormonal imbalances creating mood swings and anemia, the fear around fertility, as some of the practitioners spoke around, low energy levels, you know, having to deal with fibroids can really drain your energy, but also your mental fatigue and physical fatigue. And that impacts greatly on family life and also work life. Financial challenges leading to many women not feeling they can kind of choose some of the alternative or complementary treatments or therapies, but even simple things like personal care, you know, natural sanitary towels for a start are more costly than some of the gel abundant pads that cause a lot of overtoxicity. So, you know, many times women feel I can't make this healthier choice for myself because of my finances. And then stress, you know, stresses. And I probably should have put stress right at the beginning, actually, because for me as a practitioner, that's one of the main issues that women present when they come to me, is around their high levels of stress, how they're dealing with day-to-day family and work situations. And if you imagine women from the Black and minority ethnic communities, their experiences are compounded because of racism, you know, because of discrimination and because of other forms of oppression. And so we can't really rule out just how much trauma and stress impacts on our health and well-being, which then aggravates or can actually lead to accelerated fibroids growth. So really, how does KMT Rising Limited assist women with fibroids? Well, it's a one-to-one fibroid support coaching service. It's very personalized and it's holistic, i.e. it takes into consideration the individual and all the different aspects of their life. Because it's really not about the fibroid at all. Even though we have a fibroid day, it's not about the fibroid. It's actually about our lifestyle choices as well. And, you know, a whole host of other factors that we have to take into consideration. So for me, it's, you know, clients get guidance, they try out techniques, they introduce to new ways of living. You know, we look at diet, exercise, energy levels, supplementation, nutrition, nutrients, etc. Look at reducing the estrogen excess from harmful foods and harmful products. There's been a profusion of chemical-based products that we're bombarded with each and every day. And, you know, it does impact greatly on estrogen levels. I work around eliminating fatigue and exhaustion and stress so that people actually can take more control of their lives. They can incorporate more stress management techniques into their day-to-day life, you know, which actually reduces the fight or flight, you know, response to challenges in life. But we also look at how to replenish themselves after heavy blood loss. You know, many times, you know, as women, we have these cycles and it's just taken for granted, but it depletes us of key nutrients. And what are those nutrients that we need to put back into the body, you know, or do we just carry on as usual? And we are expected to carry on as usual, usually. I think the whole world looks on women and at having these very high tolerance levels where we can actually take on the world and carry a great load of discomfort and pain. And perhaps that's something we need to stop contributing to by not speaking out. We need to say, actually, this is uncomfortable. You know, having fibroids is not, you know, yes, it's common, as someone said, but it's not natural to us. Having heavy blood flow is not natural to us. And we need to start speaking that out. Else what will happen is the next generation of young women will continue, with those myths, and we can't afford that to happen. Also around looking at redirecting oxygenated blood flow to the uterus. As we know, the fibroids start to really starve the body of its key nutrients. And, how do we direct that blood flow back into the uterus through certain techniques? And strategies to reduce heavy periods and cramps and so on. So it is really a holistic view. It's very person-centered. But the key thing is actually starting point is about listening to each individual, reviewing and celebrating their achievements along the way, because the holistic approach is not a one size fits all, and it's not a quick fix. It's not a quick journey, And so, yes, we have to assist women in making that informed choice, really, whether they're going to treat the symptoms and leave the fibroid, or they're going to treat the symptoms and address the fibroid, or they're going to just treat the fibroid and have it out and not consider the fact that actually there is a fundamental reason, there's a cause behind why the fibroid was created in the first place. And if we just look at the invasive surgery without looking at the causal factors, then we're not really dealing with the health and well-being of that individual, And so it's about how we actually educate and inform along the way as well, and work with the conventional practitioners a lot more. So, some of the services are about getting free assessments, diagnosis, looking at some of the work I do is around group facilitation. So, fibroid and well women or womb wellness support groups, so women feel listened to. They can get support from their peers as well, because it can be quite an isolating journey, especially if you're not able to talk to family members or partners about it. And sometimes what I'm experiencing is a lot of women from different Black backgrounds, particularly from the continent, don't feel able to sometimes talk to their pastor or the person in their community that they usually would go to as the first point of contact to speak to around matters of this nature. Sometimes they don't feel able to because of the myths that Elizabeth had raised, some of the myths out there. Also offering educational classes around the anatomy of the fibroid in the first place and the different treatments, breaking down some of the pros and cons of each of the more invasive surgeries and so on, but also educational around the estrogen mimicking endocrine disrupting products that we use day to day that might not be considered as actually very harmful and contributing to fibroid growth. For instance, in Dominica, where I've been doing some great deal of work and lectures around microwaving certain plastics, or the foam-based containers in the catering industry. It's been banned now in Dominica, the foam-based plates and so on, the takeaway products, because they are highly carcinogenic. And one of the things that the community were concerned about was the high level of cancer causing, on the island. However, what they didn't look at was actually the high increase of fibroid growth and fibroid growth alongside that. There was actually an increase in fibroid growth as a result of these kind of takeaway microwavable products. And so we're looking at recyclable products, more healthy products, and educating the community, because it's not just about the health practitioners, it's actually a wider issue around people's health generally and these endocrine disrupting products. We're looking at men as well, prostate care, these are also factors to be considered. And then we're looking at practical holistic therapies, stress elimination therapies that help to bring the body back to balance, which help to prevent excess hormones being out of kilter, allow the elimination of toxins and help to create that wellness that women so need. The other area of my service is around the confidence building. Really, a great deal of BME, Black and minority ethnic women, don't feel prepared to engage with their health practitioners. They don't feel that it's their bodies and they have a say, and that's quite concerning. So it's really preparing the clients for when they're going in for a diagnosis, when they're going to talk to their GPs and their gynecologists, really, what are some of the questions that they could be asking? What are some of the concerns what they want to raise, and actually assisting them to feel empowered through that process. So I've been working a lot more with GPs on a local level to make sure that clients with fibroids get heard. So for me, really looking at improving the situation globally, I mean, much has been said already, but on a personal level, more education in the colleges and universities for younger women is definitely something we have to do. And as a Global Fibroid Alliance and all our collaborators, you know, need to be working in that way, working more with younger women in I mean, my youngest client is 20. I mean, that's quite young to be getting these conditions. More collaboration between conventional and holistic health practitioners. My experience being a holistic health practitioner is that many times it's actually trivialized actually within the conventional sector. It's seen as hocus pocus or seen as something that's not impactful. But the studies have shown that there's been a great deal of successes using holistic, natural health strategies for women. And even myself on my journey in terms of shrinking my own fibroids, I have been able to shrink them significantly through these methods. So there needs to be more collaboration between the two, you know, so that women can feel that they can make an informed choice. You know, it's not about someone coming with their own agenda for any client, really. It's about giving the clients the whole lot of information and all the alternatives and choices so that they can be informed and make the right choice for them. Fibroids disproportionately affecting us as African women. So for me, yeah, more collaboration with diaspora. So I was really encouraged that Elizabeth is on today, because many of my clients are of African origin and, you know, from the continent. And it's great to know that there's a resource and a support out there as well. And more focus on how fibroids affect women on the emotional and psychological level. So really looking towards addressing the burden, fatigue that many of us go through as well. So thank you for listening, everyone, and look forward to question and answers.
Mr. Imani, thank you so much for that awesome presentation. And I think what's quite powerful is that a lot of our panelists today have spoken about the need to empower not only women who are living with fibroids, but also empowering the next generation. And that came through quite strongly within your presentation as well. So thank you so much.
Thank you very much.
What I'd like to do is, my team, the colleagues here are indicating we do have a number of questions that are coming through in the Q&A and also in the chat. We also have a question that was posed early on in our first panel discussion. So I just want to pose this question in particular to Dr. Brian, and then we're going to ask a couple of other attendees to unmute themselves to then pose a further 2 questions if we have time to the panelists. So the first question I have here, and this is to Dr. Brian, is for someone who has already undergone a uterine embolization, what advice do you have for preventing the regrowth of the fibroids and generally maintaining womb health? That question I'd like to pose to Dr. Brian. Dr. Brian, are you there?
Yeah, I'm here. Can you hear me, see me?
Yes, we can. Yeah. Thank you.
Yeah, thank you. I mean, I'll answer it in 2 ways, one with my medical hat on and one with the non-medical hat on. From the medical standpoint and point of view, I guess it would depend how many fibroids there were and what the location was and sort of the indication for the embolization in the first place. What some practitioners may advise is then using something like the Mirena coil, which is a small device that fits inside the womb with progesterone on it, to help to sort of maintain the cavity of the womb and ensure that, you know, the cavity doesn't stick together, for example. That's a medical hat that I'm putting on there. But actually, personally, and also listening to all the talks, particularly the talk that we've just had, and I do apologise, was it Imani, I think her name is. I think the holistic point of view, absolutely, you know, just focusing on diet, on the health, on everything else, just to try and maintain womb health.
Thank you so much. Thank you, Doc.
Candice, you're on mute.
Yes, thank you. Thank you, Dr. Brian. So Abby tells me we have a number of attendees with their hands up. I can't see names on my screen at the moment. Let me just click on gallery. No. So if possible, sorry, Elizabeth, did you want to answer that question as well before we take further questions from our guests? You're muted. Elizabeth? Yes, we should be able to hear you now.
Oh, my question, no, I have a question, but it's not related to what the question that was asked.
Ah, okay. Okay, so what we're going to do is we're going to try and take some live questions from a couple of the attendees. So Abby, are we able to unmute some of the attendees?
So we have Sonia has her hand up and M. Bell. So I'm going to try. So Sonia has had her hand up for a while. So I don't know if Sonia, you still have your question. So I'm going to see if I can allow you to speak and then you can ask your question. So I've just asked you to unmute, and if you have a question, you can ask it.
Sonia MC, that is.
Yeah. Sonia MC, yes. No, doesn't look like she. No. Okay, then. And then there's M. Bell has a question. So I'm going to see if I can ask you to unmute, and you could try and you can unmute and then ask your question. No.
M. Bell, can you hear us? Do you have a question for our panelists? Okay, I think what we'll do then is we do have a number of other questions, Abby. So before I introduce the other panelists, if I can just ask another question, is that okay in terms of time?
Yeah. Time is running, but I think it's fine. It's
lovely. Okay, so the question I have here is there any study to understand the genetics behind fibroids? We seem to talk a lot about nutrition and treatment, but not the understanding of why we have fibroids. So that's a question, I guess, to all of our panelists. So I'm happy for either one of us, either one of yourselves, to take that question.
Sorry, what was the question again, please, Candice?
Let me read it again. So the question we had in the chat was, is there any study to understand the genetics behind fibroids? We seem to talk a lot about nutrition and treatment, but not the understanding of why we actually have fibroids.
That's a good question. I mean, I can only look at it from, you know, my studies in terms of looking at it from a traditional Chinese medicine perspective, really, and also looking at it from toxicity, you know, looking at what causes toxins in the body, leading to estrogen excess. And also generated heat as well, you know, a abundance of heat in the body. And so, you know, there's lots of research, and a lot of the research around fibroids talks about what are fibroids and not necessarily what creates the fibroid in the first place. And when we look at that, there are some common emerging patterns, which is around over-toxicity, you know, whether that is over-toxicity in terms of the diet. That's why we can't really look at one thing. It has to be a lifestyle change, really. It has to look at environmental factors. It has to look at dietary factors. It has to look at stress management and the whole, really, as to what causes toxicity in the body that can lead to the body trying to eliminate toxins, and the liver is fatigued and unable to actually, discharge that efficiently, effectively. So liver imbalances, and so on. So, there's a lot of health practitioners here that would look at the function of liver failure, liver weakness, and so on. And how do you get to maximize liver functionality to assist women to eliminate toxins properly from their body? So from my point of view, I'm looking at toxins as how that can then create an excess estrogen situation for women. That's from my perspective.
Thank you. And I suppose when we relate it back to genetics, it's that whole conversation about lifestyle choices and where we're getting that sort of toxication from that is being, pumped towards our liver. So thank you very much. Thank you. So just before we introduce the next two panelists, another really interesting question that came up was about employers. So the question I have here reads, what reasonable adjustments and ways does the panel think employers can support employees at work who suffer with fibroids? Again, this goes out to any one of our panelists. And I think perhaps maybe Elizabeth, your thoughts?
Thank you so much for the question. What I would say is that until our leaders, our governments realize, or the medical community realize that fibroid is a big issue, nothing much can be done about this. Because in our part of the world, even women who are affected by fibroid, if it happens that they absent themselves from work a day, two, and it continues, then I have a patient who was given a query letter for absenting herself from work continuously. And many of the women suffering from fibroids cannot go to work, especially those who have symptoms that are very difficult to handle. They cannot go to work, but because there are no policies, there is nothing, nobody respects that cause. Nobody looks at it as a problem. It is difficult to even stand anywhere and say that a woman who has a fibroid should be given some consideration when it comes to absence from work or leave or anything. So I think as the discussion is going on and as we are looking for ways to help in this issue, we should also be targeting that policies come out that will help in this case. Thank you.
Thank you. Thank you so much, Elizabeth. Does anyone else would like to answer this question? Okay. Okay, so thank you so much for taking those questions. We are going to move on now and introduce the other panelists that we have who have patiently been waiting. And thank you so much, Abby, for supporting that part of the webinar. So our next panelist, I will introduce as Anjali Mbagara is a consultant in human resources and labor law with 15 years of experience in the field of consulting and management. She was confronted with fibroids in 2008 and went through a surgery 2 years later. In January 2011, she founded the association named Fibrome Info France to address the lack of information and awareness about this condition among French women. Coping with this illness and creating Fibrome Info France marked a turning point in her personal and professional life. In order to shape this experience into a positive force, she manages the delicate balance between her professional career and her commitment to the association by using her expertise as a patient and her professional experience for the cause of women with uterine fibroids. Fibroid Info France is the first and only French association that works for the health of women suffering from this disease. And each year since its creation, they accompany about 2,300 to 2,500 women in their care pathways and search for comfort, listening, support, adapted treatments, and information on fibroids. Now, Angelique cannot be with us today, I'm told. However, she has sent her colleague, who is Nina Manga, who is a legal assistant and a novelist. Her entry into womanhood at the age of 12 was marked with pain. Then she had her first surgery due to fibroids at 24 years old. It took another 5 years before Nina's endometriosis was diagnosed. And this journey was later perceived as a call for her to return to nature. Responding to that call led her to settle in Cameroon, where she is involved in the fields of agriculture, bookkeeping, and the promotion of local cultural riches. So it gives me great pleasure to introduce Nina on behalf of the Fibroid Info France. Nina, welcome.
Yes, can you hear me or see me?
We can hear you. We can see your lovely picture. We cannot yet see your video.
Sorry. Well, let me try again. I think it's blocked. So for some reason, I don't know why.
Let me sort that out in 2 seconds.
Okay.
Thank you, Abby. Welcome, Nina, and welcome. We know that you are here on behalf of your colleagues, so we appreciate that.
Yes, that's it. So may I start while we try to solve the problem?
Absolutely.
Okay, you should be able to share your video now.
Thank you. Thank you, Abby, and thank you all for this wonderful movement. I am really delighted to be among you and proud to represent Fibroid Info France in the absence of its founder, who is Angèle Mbarga. She might join us later for the Q&A, so we'll just talk. I don't know why you can't see me, but okay, maybe it's. Let me try again.
We see you.
Okay, perfect. Thank you. Yes, so 10 years ago, it would have been really impossible for me to talk about this topic without crying, because it has been a long journey dealing with fibroids and endometriosis. I can say I was lucky enough to find my holistic path and also have support from Fibroid Info France, which is, as you heard, the only French association dedicated to fibroids. But there's really still a lot of work to do on the national level as far as France is concerned, because uterine fibroids are still the most common non-cancerous tumor among women of childbearing age in France. And on average, 1 out of 4 women still suffer from this condition in France. So the two main challenges we face are the banalization and misrepresentations from some medical professionals, even though fibroids are the leading cause of uterine ablation. For example, the common view is that women are most likely to have fibroids by the age of 40, which is obviously incorrect. And the second challenge is that the diagnosis and medical care really needs to be improved, in a sense that hysterectomy and myomectomy might not always be the only options. So we believe that raising awareness of painful and overabundant periods is a major societal and educational challenge, because periods-related issues are often the common denominator between several gynecological conditions. So the actions taken by the association, in addition to what is basically what is basically done until we started this movement in 2008, is providing women with information, with support groups, with network of healthcare professionals, including specialists in medical imaging, reproductive health, but also midwives and holistic health practitioners. Can you still hear me? I don't know.
Yes, Nina.
Yes, we can hear you.
Okay. So this year on March the 8th, with the support of the French Ministry of Women's Rights, the association launched a national campaign which is ongoing to raise awareness of uterine fibroids among girls, women, and the general public, in order to improve early detection of this disease and better the medical response to it. So we work with 550 French hospitals and clinics that are partners to our ongoing campaign. What we would like to see in France and on a global level to improve the situation for all women with fibroids is a recognition of the fact that the symptoms of fibroids affect a woman's intimacy, but they are at the intersection of health and societal issues. For example, at 17 years old, I missed a major exam because I happened to have tachycardia on that day. And no one was able to determine that anemia due to fibroids was responsible for that condition. That's why Fibroid for France is advocating for a multidisciplinary approach that would take into account the impact of fibroids on women's quality of life, sexual and reproductive life, health as well. We also advocate for raising women's voices to break persistent taboos, to change mentalities, and to help research, or well, simply because it's about time we become key players in every decision regarding our bodies. So I thank you all for giving us the opportunity to empower and support and get to learn about each other's. And if you have any further question or just feel free to contact and reach out. Thank you.
Thank you so much, Nina, and thank you for your patience. And to all of the guests as well, thank you, Nina. To all of the guests as well who are waiting. I know we have run a little bit over time. So moving on very quickly, I'd like to introduce our last panelist, who is Valerie McKen, who founded Woman Wise Health due to her own suffering with multiple fibroids and heavy bleeding for many years. After 2 surgeries and being hospitalized with severe anemia, she made a pact with herself to heal her wound naturally. Her healing journey brought her to discovering the true path to healing. All her energies are now focused on helping women who suffer with the same conditions, utilizing the gifts of nature utilizing the gifts nature gave us in abundance, which is whole foods and herbs. Valerie's mission is to fill in the gaps with missing knowledge of how the body works, not only to prevent vital organs began removed, but also to empower women to take charge of their health and become their own healer. Valerie has been working in health and well-being and the well-being space for 17 years and is a nutritional therapist, detox specialist, raw food chef, and vegan nutritionist. Valerie McKen, thank you so much for your patience. I'd like to hand over to you.
Thank you so much, Candice, and thank you to everybody else as well. I'm really grateful to be here with this global movement. It's really wonderful to see. Now, I think everything that has been said about fibroids has already been said. So I'm going to take this from a completely different angle now. And it's something that we don't tend to look at because we go on about the research, which I think is very important. But having suffered with fibroids and heavy menstrual bleeding for so many years now, since my early 20s, you know, I went on a mission to find out the reason behind fibroids, but I found that I wasn't getting any real answers from medical professionals, no matter which website I went on, because I always go on to the NHS website. But I dug and I dug. But what I can tell you is that we're facing an uphill battle, and I'm going to tell you why that is. And I'm going to be quite short and sweet about it. So one of the questions I kept asking myself when investigating fibroids and the reasons behind fibroids was, why is there such a high prevalence? You know, you know, there's such a high prevalence, but there seems to be a lack of research, decent research. I mean, there is research out there if you have a look, but it's on mice and rats. And I'm thinking, well, us women aren't mice and rats. And when you do find research that uses actual women, it's very sparse, and usually more studies are then needed to clarify their findings or to back up their findings, but these never seem to materialize. And that's what I wanted to understand why. So I'm going to show you some, I'm going to share my screen. Hopefully you'll be able to see this. Let me just move that. Right, just let me know if you can see that.
Yes, we can see.
Yeah, okay. Right, so essentially there's a whole marketing behind this, behind fibroids and fibroid treatment. Uterine fibroids, in terms of the market share, because if you look at, there's a uterine fibroids market research report, and the uterine fibroids represent a large proportion of income for the medical industry. And as you can see, that's 9.3 billion within the next 6 years. So I want to propose a question to you. Do we honestly think that a market worth that much is going to do research into what causes fibroids and help us get rid of them for good? Let's have a think about that. So let's look at the next one. So you've got the market analysis, the US. This is all US based because I can only ever find numbers for the US. So as you can see, the market size in 2020 was 2.43.5 million. And that obviously the value projection by 2027 has jumped to 2.98.5. So as you can see, I think that's around about a 3% jump. So as you can see, there's value in us having fibroids. So, and then you've got the treatment devices market analysis. So what they're doing is they're making more and more surgical devices, and that you've got all these companies here that you can see that are all competing for a share of the market. So tell me again, if there wasn't, if there was a reason for them to research fibroids and really help us in a way that would benefit us, that we could actually understand and get rid of these things, they're annoying, because let's face it, they're an annoyance, then why would they have all these market analysis reports? So let's look at the next one. You've got the market dynamics. Right, so this graphic shows you what's driving the market, the restraints and the challenges they face. We're talking about our own challenges, but they're talking about the challenges they face with minimally invasive procedures, because not many, because not everybody wants to go out and lose their womb. And if you look at the segmentation analysis, which is this bit here, you see there's only two options: hormonal treatment or non-hormonal treatment. Clearly, the uterine fibroid market is a big one, with the growth, as we've seen, only set to continue. So when you think about it, there wouldn't be any need for market analysis if the medical industry were actually keen to resolve the issue. And then we have the elephant in the room. Now you can look this up for yourself as well. This blog post was written by Boris Johnson back in 2007. Again, you can look this up for yourself. And this is what he states on the blog post. All the evidence shows that we can help reduce population growth and world poverty by promoting literacy and female emancipation and access to birth control. Isn't it time politicians stopped being so timid and started talking about the real #1 issue? So could this be the reason why many gynecologists are now promoting hysterectomy as a frontline cure for fibroids? You know, what does Boris mean when he says female emancipation? Freedom, female emancipation, freedom from what? Freedom from giving birth or the burden of having a womb? So what happened to the Hippocratic oath of first do no harm? There's a tendency for us to get into dangerous territory when we start lobbying government and asking them to help, asking them for help to establish why women worldwide are afflicted with fibroids, when their agenda is quite clear. I think this is my own personal standpoint, but I think we've been far too reliant on others to look after us when our bodies go wrong. And I think this really does need to change. Don't get me wrong, I'm not saying do not ever go to the doctors if there's something wrong or if you do indeed need surgery. But what I will say is that you can get what you need from the doctors because that's what they're there for, and then you can go from there. I founded Women Wise Health with the aim of empowering women to take back responsibility for their health and their well-being, build immunity, as well as prevent disease. So not only do I look at the food, but I look at lifestyle and stress. And stress is one of the key factors in fibroid growth. The issue with fibroids that needs to be tackled, but personally I feel it's something we need to do as a collective without the reliance on external bodies. We may look to them, but I think judging by the fact that there's a big market out there, I think we probably need to rely less on external bodies. But because the minute we do and we go to others for help, I'm sure we'll be faced with some kind of limitation or restriction that will be imposed upon us. So, for example, when you ask external government bodies to assist, especially with funding, no doubt these will probably come with lengthy terms and conditions that you'd have to stick to. In order for us to proceed and to start moving forward with this, I've always felt that we need our own research laboratories to establish our own values and ranges when it comes to doing any kind of test, especially when it comes to doing blood works, urine tests or stool tests or something like that. Because when we have tests at the doctors that we go to now, the value ranges is based on European values. So we could end up being treated for illnesses or disease when nothing's wrong. And there is a research out there that actually shows this is the case. But we wouldn't necessarily know that because we don't have our own baseline because melanin dominant males and females, we have a different biochemistry and that's not being taken into account. So yes, there is need for funding, and of course something like this it's going to be a global thing and it's not going to be cheap. But I reckon there are enough women and men, hopefully, in the world suffering who would love to see this happen and may want to contribute. I think in the end, the ideal is to establish, in the meantime, integrated clinics where there are both medical and complementary therapies working in tandem not only to remove fibroids if surgery is warranted, because often it can be, definitely, but also to prevent any chance of them recurring, and that's the key. I feel like, to end, it's important to look at what we can do rather than running off to, to government and whoever else who have shown us time and time again what they think about us. So these are my contact details. My email and my Facebook group was Womb Wellness Warriors. And I'm going to leave it there. But thank you very much for listening. And I'll be happy to answer any questions that anybody has. Thank you.
Valerie, thank you so much for a very powerful end to today's discussion. I am going to swiftly hand over to Abby to close the Global Fibroids Alliance discussion today. Thank you once again, Valerie. Abby, over to you.
All righty. Hi, everybody. So we've gone a little bit over time, so I do apologize. We're due to end at 1 o'clock, but it's now almost 1:30 over here. So I would just say, if there may be one or two questions, maybe we can quickly take them, because I know people didn't have the opportunity to ask a question of the last couple of speakers. So if there's any one or two questions, particularly anybody that's French speaking, maybe if they have a question, maybe they could ask it. But if not, then we might have to start wrapping up, because we want to respect everyone's time. There are a few questions in the Q&A, so I might ask the panelists if they want to type into the Q&A some of the answers to those questions. But yeah, let me see if there are any specific questions, particularly I think for Nina and Valerie. I might be missing it, but I don't really see anything in particular. I think if you have any questions in French, if you see any in French, just let me know. Okay, all right, it looks like, okay, somebody says they have a question. Cece, go ahead, you can type in your question quickly, and then maybe we'll. Okay, because I think Cece might be a French speaker, but okay. All right, so if we don't have any questions, then I'm going to basically wrap up. So I just want to wrap up by saying thank you so much to all the panelists today. So Joanne, Korice, Shelly-Ann, Jenny, Elizabeth, Valerie, Imani, Angel, Nina, and Dr. Stacey Ryan. Thank you so much for your contributions today. It was so insightful and really great to get a really nice, well-rounded discussion around what is going on globally with fibroids. So I just want to say a big thank you. It has been a pleasure to work with all of you in terms of putting this together. A big thank you to the moderators, Dr. Sydney Dillard and Candice Bryan, for moderating so well today and for allowing people to have their voice and to speak up. I'd also like to thank all the people that have worked behind the scenes. So that would be Olivia Holtman, who's been helping us with the chat and also helping with organization, Julia Mandeville as well, who also is helping behind the scenes as a member of the Global Fibroids Alliance, Saida Telsford as well for helping with some of the administration. And also just to say thank you to everybody for attending today. So what we'll do is we'll send an email around with the recording of today so that you won't miss anything. We'll also have information and links to all the speakers and panelists to their websites, and so that you can contact them afterwards. But if there are no other questions, we're going to wrap up. But we will attempt, for those questions that we weren't able to answer, we will attempt very hard to see if we can try and answer some questions afterwards and send those answers by email. So we'll try very hard to do that. So just thank you everybody for joining us today. And what we hope to do is try and put together like a little report with the key points that came out of today so that we can use that as an advocacy tool to try and sort of advocate for the change that we want to see. And we definitely recognize the point that some of that change needs to come from us and some of that change needs to come from others. as well. So we recognize that and we're appreciative for the discussion around that. So thank you so much, so much. And we will end, but if you want to hang around a little bit, feel free to do so as we look through some of these questions, but that's it. Thank you so much, everybody, for joining us. Yeah, we do appreciate it. I think somebody was asking about Shelly-Ann. I don't know if Shelly-Ann is still on. No, Shelly-Ann. Somebody was asking about your contact details. I don't know if you want to feel free to share. If Shelly-Ann is still there. Okay. No, I think Shelly-Ann is not. Yeah, Shelly-Ann, somebody was asking for your contact details. So anyway, thank you, everybody. So we'll just hang around maybe for another 5 minutes or so, and just see if, let me just see if there are any straightforward questions that we can answer in the next 5 minutes. Somebody's asking about food supplements that can be taken for womb health. Would anybody like to quickly answer that one? That might be a one for Imani.
Yeah.
Oh, okay, Valerie, go for it.
Yeah, I can answer that. Well, when it comes to supplements, you firstly have to know what you're short in, essentially, because you can just take something and it not work. And it depends on what you're taking it for. Is it to correct a deficiency? If that's the case, what deficiency do you have and how do you know you have it? Because some people often just go out and buy supplements without any real reason, without knowing, or they've just done their own research saying, okay, this certain supplement like green tea extract may shrink fibroids, but don't really understand where they're at. They need a baseline. And also you've got to think about supplements, especially if the active components are just extracted from certain foods or just grown in a lab. They're not going to have the same impact as if it was coming from whole foods. So you firstly have to sort of understand, right, why am I taking this supplement and what am I taking it for? And do I need it?
Yeah, I would echo what Valerie says. In the sense, it's not a one size fits all. You really do need, some level of assessment on your personal physiology as well, and allergies, etc., as well as what you're deficient and excess in already. You could actually be causing more harm than good. So it's always best to check those things out.
Okay, wonderful. So we will end. So thank you so much, everyone. Valerie shared her contact details in the chat if anybody wants contact details, but we will definitely share contact details of the information about the panelists in the follow-up email, so links to their websites, etc. So you get all of that. And thank you so much. So we'll end in like 5 seconds. I'm just looking at something here that's come up. Yeah, so we'll end in 5 seconds. So do any of the panelists want to have any final words or anything before we close out?
Thank you to you, Abby, for
yes.
being the captain lady of the ship. Yeah, thank you for that diligent, consistent work behind the scenes.
Oh, thank you so much. I appreciate it. Thank you so much. Korice has her hand up. Korice, did you want to have any final words before we?
Definitely. As Imani shared, thank you for continuing the amazing work in driving the GFA collective. And thank you for the opportunity to share. I am excited. I am invigorated to continue the work. We spoke, some of the challenges I've faced this year, but the work continues. And so I am excited and just refreshed. Thank you to everyone as well, and all the best. If I could use Valerie's word, we are women warriors, we are womb warriors, we are women warriors. And I encourage all of us to continue on our individual journeys and of course the collective journey to impact change on the reproductive health landscape across the globe.
Thank you, Korice.
Yeah, thank you, Abby. Thank you very much.
You're welcome. It was so wonderful to hear your perspective. Thank you so much.
Thank you, Valerie. Thank you, Sydney, Candice. Thank you, Elizabeth. Thank you, everyone.
Yeah, thank you all.
Yes, thank you, Imani.
Thank you.
Abby, everyone, thank you.
Everyone, thank you. God bless you all. God bless you.
Great. Thank you
Have
so
a
much.
nice weekend.
Thank you so much.
Yeah, have a nice weekend. So we'll end in 5, 4, 3, 2, 1.
Bye.
Bye, everyone. Bye.
Bye.
Bye.